Hi, my name is Prashant Aburathaki and my student ID is U3212147 and this is my student ID. I am a student nurse and I will be demonstrating the care of patient on orthopedic ward. According to the case scenario, Elsie Jones is a 65-year-old woman who has been brought to the hospital by ambulance after a fall at home. She has suffered from a fractured right neck of femur and had a surgery 2 days ago with no complication of surgery. She has a history of hypertension and cardiac disease. Her vital signs are within normal limit. X-ray examination shows that she is suffering from osteoporosis and she has been commenced on a calcium supplement and vitamin D supplement for it. She is divorced and lives alone. She has a surgical incision which is clean and intact under a clear surgical dressing with a minimal post-operative ooze. She is mobilizing slowly and she is seeing a physiotherapist for her daily mobilization and leg exercise. Her pain has been well controlled by analgesia and endone. Considering her priorities, the number one priority for her would be pain management, as she is recently had a post-operative surgery and have a wound dressing. She is taking PRN, paracetamol and indone occasionally. I will be conducting pain assessment using the PQRS module, which stands for provocation, quality, reason, severity, scales, and timing. I would also ask her about the pain before and after the paracetamol, and I would conduct timely reassessment and check her vitals time and again. The second priority would be wound management. She recently had a post-operative care of surgery and she has dressing that needs to be intact for 7 days. I would use antiseptic non-touch technique to keep the wound clean, check for her oral antibiotic effect, check for debridement while dressing, and continually review her wound. My third priority would be mobility care, as Elsie has a post-operative care of NOF and suffers from osteoporosis, as well as she is high risk of blood clotting. She needs to have a TED stocking on while walking. She needs to have supervision during her daily walk and shower, as well as her daily living. We also need to take care of her pressure injuries, as and we need to reposition her daily and as required to prevent any kind of accidents. We also need to make sure she has been provided with incontinent aid, so in order to avoid any kind of accidents. And the three primary healthcare worker to support her after she returns home would be occupational therapist, who would help her to improve her independence and safety, and also helps her with her rehabilitation. The second person second healthcare worker to support her would be a physiotherapist, who will help her in the treatment of her mobility and function and well-being of Elsie. They will be helping her through physical rehabilitation and injury prevention and health and fitness, and help her with any kind of exercise and mobility. The third person for her would be a social worker, who can assist her in transfer from hospital to her private home and organize different programs according to her needs. So after all this, my first step would be introducing myself to Elsie as a student nurse. And before entering her room, I would have the 5 moments of hand hygiene for infection control, which would be before touching a patient, before cleaning, an antiseptic procedure, after bodily fluid exposure, after touching patient, and after touching patient's surrounding. And the second method would be correctly identifying the patient, which would be asking for her name, date of birth, and checking the URN number. comparing it with the file and wristband on her hand. We should be also asking about her allergies and history of allergy. And before administering any kind of medication, and the three checks for the S8 and S4 drugs would be when medication are pulled and before dispensing. And the second would be before when preparing the medication, and the third would be on the bedside of the patient. And about the discharge, we should be educating the patient on self-administration of medication, like with the Webster pack, different colors and day and night of the Webster pack. We should be educating the patient about the Webster packs, community service. We should be talking about the discharge summary with the patient or her family. We should give the details about the medication and information about the medication, and recommend the time and review for the medication. We should also be providing the patient family and carers with an accurate list of medication, proper storage of the medication, what to do if the dose is missed, and potential side effects of the medication, and when to call a GP or pharmacist about any concern. Pharmacists and hospital can also arrange medication, which is a good way to see if the patient can take the medication independently. She also needs to be educated to complete her dose and oral antibiotics. Thank you.